Welcome to Essentials of Pharmacology for Health Professions, 9th edition, Chapter 8, Administration by the GI Route. Upon completion of this chapter, you should be able to describe the advantages and disadvantages of administering medications orally, rectally, or by percutaneous endoscopic gastrostomy, or your nasal gastric tube. Explain the appropriate action to be taken when a patient is NPO, has dysphagia, refuses medications, vomits the medication, or has allergies. List the special precaution to be followed in the preparation of sustained release capsules, enteric coated tablets, and oral suspension. Demonstrate the measurement of liquid medication using a medicine cup and syringe. Demonstrate proficiency in administering oral medications. Demonstrate proficiency in administering rectal medications. And your last one is to discuss administration by your PEG and NGT tubes. Your gastrointestinal is the most common route of medication administration. Your GI medication administration has 4 categories, which is your oral, rectal, PEG, and NG. All of the above mentioned routes has its advantages and disadvantages regarding medication administration. Let's take a look at our oral administration. It's convenient and its patient is comfortable. It is more safe because some of the medication can be retrieved in case of error or intentional overdose. It is cost effective due to less equipment utilization. It is preferred over injections. Our disadvantages are a slower onset of absorption and action. The rate and degree of absorption vary from the GI contents. Some drugs like your insulin and your heparin are destroyed by the digestive fluids, so they have to be administered by injection. It's hard to use in patients that has nausea and vomiting. It's dangerous to use with patients that's having difficulty swallowing because of possible aspiration. So what is aspiration? Alright, it cannot be used for unconscious patients. It may not be able to be used in patients if they're NPO, like if before surgery, because if they have an acute medical condition, or if they just are fasting for a test. Sometimes medications are administered by the NG or the PEG tube when patients are unable to swallow for a period of time due to illness, trauma, surgery, or unconsciousness. Our next route is our PEG or NG administration. The advantage is we're able, the ability to bypass the mouth and the pharynx when it's necessary, and it helps eliminate multiple injections. Some of our disadvantages is discomfort to our conscious patients, and then our prolonged placement of tube in the nose and the throat. Alright, our rectal administration, what are some of our advantages? Bypassing the action of digestive enzymes, avoidance of irritation to the upper GI tract. It is useful with dysphagia. Some of our disadvantages are unavailability of many medications in suppository form. Some people have difficulty retaining the suppositories. You can also have rectal irritation or irregular or incomplete absorption due to the presence of feces. Usually it's used when people is nausea and vomiting. Here are some guidelines for administration of oral medications. As a healthcare professional, it is important to understand proper administration of oral medications, from accepted hand washing techniques, locating your medication, reviewing the physician's orders, preparing the dosages, verifying and identifying the patient, dispensing the medication, to properly documenting the patient's charts. These rules of responsibility are critical to ensure patient safety. The figure that you're looking at is the proper administration of oral medications. Now there is 18 steps in giving oral medications. So if we'll look at number 12, like monitor the patient's vital signs if required for the specific medications. Sometimes you can have blood pressure, apical pulse, or respiration. The blood pressure should always be taken and recorded before administering any antihypertensives. And also, if you look at number 13, it tells you open the unit dose package and place the container in the patient's hand. We always want to make sure we're wearing gloves, that we never touch the medications that we are going to give to our patients. These are some of the things that we really need to think about, and we will be learning more of these come next semester. Okay, let's check your knowledge of what you've learned so far. The question is, what is an advantage of oral medication administration? Look at your choices, write your answer down, and you can check it at the end of the video. MPO special consideration. Anytime there's a patient with MPO orders, it is always important to check with a healthcare professional in charge regarding the appropriate procedure of medication administration. If a patient is fasting for tests, medication can usually be given at a later time with possible modification or with clear liquids if the physician approves. If a patient is MPO due to surgery, nausea, or dysphagia, it may be necessary to consult with the physician regarding a route administration change. It is imperative to not omit the medications completely without specific instructions. If a patient refuses to take a medication or vomits within 20 to 30 minutes of taking that medication, please report this to the healthcare professional in charge. In addition, document the patient's record with time and appearance of the emesis to check whether the medication remained intact. It is also important to document the reason for the patient refusal if they refuse to take the medication. Documentation is the key. Now, there is 13 steps for this area, special considerations for oral administration. On step 13, it talks about tablets, it talks about capsules. Make sure that you read that and what you can and cannot do with those tablets and capsules. Alright, let's take a look at this knowledge check activity. If a patient is MPO, some medications can be given with, look at your choices, and you can write down your answer and you can check it at the end of the video. Okay, we're going to talk about preparation precautions for liquid medications. Your first step is to shake it if it's indicated. We're going to remove the cap. I'm going to place it upside down on the table. There is figure 8-6 for you to look at. You're going to hold the medicine bottle with the label side upward to prevent smearing. At eye level, pour a prescribed amount of medication. 2 is replace some medication bottles in the cupboard or medicine cart. Compare the information from the orders to the label on the stock bottle. Replace the cap of the bottle. Recheck the 7 rights of the medication, which are right medication, right amount, right time, right route, right patient, right documentation, right technique. And then you're going to proceed with the guidelines for administration of oral medication. Preparation precautions for sustained release and enteric-coated medications. First, it tells us not to crush the content in a sustained release form or allow patients to chew it. Next, it tells us to review the package insert or seek assistance from pharmacists if the patient is unable to swallow. We double check the medication to ensure specific foods are allowed. We wipe down any equipment that may be used to modify the medication for administration and proceed with the guidelines for administration of oral medications. Okay? Basically, this takes us back to step 13. Let's check your knowledge activity, which is not a precaution when administering a liquid suspension medication. Look at your choices and you can check your answer at the end of the video. Liquid medication measurement and administration. Let's take a look at the proper steps of measuring liquid medication. You want to pour the prescribed medication to the medicine cup. As always, screen for the 7 rights of medication administration. You want to withdraw the prescribed amount with a syringe. Check the medication against the orders using the 7 rights of medication administration. Identify the patient or scan a wristband if you're using an EMR or verify the patient name and date of birth. If you look at the pictures, it gives you an idea as you are pouring the medication or if you are drawing it up using a syringe. Alright, so the proper steps administering liquid medications. So we want to identify our patient and scan the wristband if we're using an EMR or we want to verify our patient's name and the date of birth. Again, we want to make sure their head is elevated. We want to make sure that the patient is alert and they can swallow. And then if they can, we place the syringe tip in the pocket between the cheek and the gums. We want to make sure that we seal the medication slowly so we can lessen the chance of aspirations. We also want to double check and make sure that the patient swallowed their medication completely. We proceed with the guidelines for the administration of oral medications. And then, of course, we always have to document. We document when we gave it, how we gave it, how they tolerated it, and so forth. We also know that the liquid or oral medication is preferred form for the children that are less than 5 years old. In addition, they also like flavored medications because the children tend to tolerate it better. Let's check your knowledge. When removing the cap of a multi-use liquid medication bottle, the cap should be placed how? Look at your choices, write down your answers, and you can check it at the end of the video. We're going to check your knowledge. Before administering oral medication to a patient, the health care professional should do which of the following? Look at your choices, write down your answers, you can check it at the end of the video. Alright, so we're going to talk about administering rectal medication. There are times medications are ordered to be administered through the rectal route. This route is usually used for small children who cannot swallow medication, patients that are comatose, patients that has nausea or vomiting or both, and those who cannot swallow pills. The rectal medications may be in suppository or liquid form and is administered as a retention enema. The retention enema must be retained for approximately 30 minutes or more for absorption of the medication. The patient should be instructed to lie quietly on either side to aid in retention. Remember to always treat the patient with dignity and always explain everything you are going to do and why you are doing it. Okay. While we are getting ready to do it, we want to make sure we wash our hands with the accepted technique. We need to make sure we compare the label against the medication and check the medication order. And we're going to be using the 7 rights. We identify the medication and research the information if necessary if we are not familiar with it. We never give anything we are not familiar with. We want to make sure that we assemble our supplies, which will be some disposable gloves and water-soluble lubricant. You want to check the patient identification and verify the patient's name and date of birth. You want to make sure we have the right person. You want to select the medication as ordered and double check medication name and dosage again. You want to explain the procedure and answer any questions that the patient may have. Close the door and curtain completely. You want to lower the head of the bed and position the patient on the left side with the upper knee bent. Keep the patient covered, only exposing the rectal area. We want to apply our disposable gloves. We put on our disposable gloves and we remove the suppository from the wrapper. Lubricate the taper end with a water-soluble lubricant. With a non-dominant hand, separate the patient's buttocks gently so you can see the anus. Ask the patient to take a deep breath. Insert the lubricated suppository and push gently with gloved index finger until the suppository has passed the internal sphincter. Urge the patient to retain suppository for at least 20 minutes. If they are unable, hold the buttocks together as required. You want to remove and disclose the gloves. Be sure the patient is comfortable with covers and bed adjusted appropriately. Wash your hands, and then you're going to document the time, the date, time, how the patient tolerated it. Okay, let's check your knowledge, which describes the positioning of the patient's legs when utilizing the rectal route for medication administration. Look at your choices, write down your answers, and you can check it at the end of the video. Okay, so we're going to look at the PEG and the NGD tube are not inserted for the sole purpose of medication administration. However, it may be a good source of medication administration if it can be administered through the PEG or NGT tube. The administrations include as follows. You want to check the medication order using the 7 rights of medication administration. You want to compare the label against the medication sheet. If the medication must be given on an empty stomach and the patient is receiving a tube feeding, hold the medication. Stop the feeding for 30 to 60 minutes, depending upon the medication being administered. Return at the appropriate time to administer the medication. If the patient is not receiving a tube feeding or the medication can be administered with the tube feeding, continue with medication administration. Always wash your hands and wear gloves when handling tubes. Make sure to prepare the medication as ordered and be sure the medication is at room temperature prior to administration. It is always at room temperature. Check the identification bracelet or verify the name and the date of birth with the patient. You want to make sure that you elevate the head of the bed if it's not contraindicated. Hold the end of the tube and remove the clamp, plug, or the adapter. You want to verify that the tube is properly placed in the stomach and verify that the tube is taped at the appropriate centimeter marking. Aspirate with bulb or piston syringe for stomach contents and check the pH of the aspirated fluids. If the aspiration does not meet these parameters or if there are any questions, do not instill any liquids and report to the healthcare professional in charge. We want to clamp the tube with your fingers by bending it over upon itself or by pinching it. After the tube is closed, remove the plunger or the bulb from the syringe, leaving the syringe attached firmly to the tubing. Flush the tube with water. Pour the medication into the syringe, release the unclamped tubing, and let the medication flow freely by gravity. You never ever want to force the fluids down the NG tube. Watch the patient during the procedure and stop immediately if there are any signs of discomfort, coughing, or shortness of breath by pinching the tube. The syringe should be at the level of the patient's shoulder to eliminate the risk of fluid running too quickly. Before the syringe empties completely, flush the tube by adding 60 to 100 milliliters of water to the syringe or the exact amount ordered. If the patient's input or output are being monitored, be sure to add this amount to the patient's record. After the water has been placed, pinch the tube, remove the syringe, and clamp or plug the tube. If the patient is on suction, be sure to leave the suction turned off for at least 30 minutes until the medication is absorbed. Then restart the suction as ordered. If the patient is receiving a tube feeding, be sure to leave the tube feeding turned off for 30 to 60 minutes. Depending upon the medication and until the medication is absorbed, then restart the tube feeding. Position the patient on the right side and or elevate the head of the bed to encourage the stomach to remain empty. Ensure the patient is comfortable, and then you want to make sure that you proceed with the guidelines for administration of oral medications for documentation purposes. We're going to check your knowledge. Patients with a PEG or NG tube should stop feeding how long or how many minutes before receiving medication through the tube. Write your answer down and check it at the end of the video. Alright, your self-assessment. What are the advantages of administering medications orally? What precautions must be followed when administering sustained release medications? List the appropriate actions to take when the patient refuses to take their medications. Thank you for listening. Your answers will follow.